Glaucoma is a chronic disease, that is, a long-lasting condition that can be controlled but not cured. This eye disease occurs when increased fluid pressure presses against the optic nerve, damaging fibers which may cause blind spots to develop or affect peripheral vision.
That's one of the reasons glaucoma is known as the silent thief of sight, or the sneak thief of sight, because this damage sort of slowly creeps up and creeps up and creeps up, and you only notice it when it starts to affect the vision you're using every day.
Barbados has a high rate of glaucoma, so it's imperative that testing is seen as vital by adults of all ages.
Most industrialized countries, the developed world, the rate is 1 to 2%, so in the States, in England, in Europe. In Barbados, the rate is 7%. And that increases with increasing age. So in most societies, you would say you need to start getting checks for glaucoma at age 40, because after that, then the rate increases. However, in Barbados, because our rate is so much higher, it is 7%, we actually see people in their 20s or 30s with glaucoma, and not just early glaucoma, with advanced glaucoma and glaucoma that's causing blindness, even at that age.
The test is usually part of a comprehensive eye check, which can be accessed either privately or in the public sector. However, free tests are offered annually in March by several eye care specialists.
This is why we encourage people to get checked for it early, so that we can pick up that damage early and institute treatment. Because in the worst case scenario, it can cause people to lose all their vision and to go blind. But if we detect it early and start treatment early, there's no reason for people to lose their vision. We can save that vision and preserve vision for a person's entire life. There are quite a few risk factors, and unfortunately those of us in Barbados and the Caribbean have many of them. If you are of African descent, it increases more with increasing age, and if you have a family history of glaucoma. Also, a lot of people refer to glaucoma as pressure in the eye, and that's because one of the main risk factors is having a high eye pressure. The theory is that the high eye pressure damages the nerve over time, and then you get the damage to the vision. So having a high eye pressure is actually the number one risk factor for glaucoma. If we see that somebody has damage to the nerve at the back of the eye, then we usually refer them on for another test called the visual field test, which checks the peripheral vision. But today we're just going to do the preliminary test. All right. This machine is called the slit lamp, and this is what ophthalmologists will use routinely to do all examinations of the eye. So it's not just about glaucoma. This checks the eye for everything, cataract, etc. But today we're just looking for glaucoma. Just lean your head back. We first put some eye drops in to numb the eye and make this comfortable for the patients. And let's do the other one. Head back, look up above your head. And these don't sting at all, they're perfectly safe. We use them in babies and children. And just look towards my ear over my shoulder. So what we're doing is we're using the light within this machine and the magnifying lenses to get a very detailed view of the front of the eye initially, and then we'll do the same thing to get a detailed view of the back of the eye as well, and look at the optic nerve, which is the nerve to the eye and what we're really interested in for glaucoma. This is a special lens that helps to magnify and visualize the nerve to the eye. And that's good. And do the same thing on the other side. Okay, that's good. And then we'll put some other drops in to check the eye pressure. All right, you can rest, you leave your chin on the chin rest. And I'll put these in there. These ones go in slightly differently. So look up.
Okay.
Good, so now that we've put those drops in, the surface of the eye is numb, and that allows us to get the most accurate measure of the eye pressure. And just keep looking straight ahead and stay nice and still. Very good. And this machine is calibrated so that we can just read the measurement off. And we do the same thing on the other eye. Looking straight ahead again, stay nice and still. Good. And that's it. Eye pressure done. Optic nerve check finished.
Patients receive the results immediately and are advised, based on the outcome, what the next step will be. In part 2 of this program, you'll hear from a patient how they have adjusted to living with glaucoma and learn about treatment options.